Medical revalidation of Puerto Rico, methanol poisoning. Clinical question. A 45-year-old man is brought to the emergency department after being found disoriented and vomiting. He admits to drinking homemade liquor. On examination, he is confused and his vision is blurry. Laboratory findings show anion gap metabolic acidosis with an increased osmolar gap. Fundoscopic exam reveals optic disc hyperemia. Which of the following is the most likely diagnosis? A. Ethylene glycol poisoning. B. Isopropanol intoxication. C. Methanol poisoning. D. Salicylate toxicity. Correct answer, C. Methanol poisoning. Explanation. Methanol poisoning occurs after ingestion of substances like homemade liquor, windshield washer fluid, or antifreeze. It is metabolized in the liver to formic acid, which leads to metabolic acidosis and ocular toxicity. Key clinical features: CNS depression, confusion, coma, optic neuritis, blurred vision, blindness, optic disc hyperemia, anion gap metabolic acidosis, increased osmolar gap, severe cases, respiratory failure, seizures, death. Diagnosis: ABG, metabolic acidosis, low HCO3 in urine, high anion gap, serum osmolar gap elevated, fundoscopic exam, optic disc edema, late finding. Why not the other options? A. Ethylene glycol poisoning, incorrect, renal toxicity, flank pain, oliguria, calcium oxalate crystals in urine, rather than optic toxicity. Also causes anion gap metabolic acidosis, plasmolar gap, but kidney failure is the key finding. B. Isopropanol intoxication, incorrect. No anion gap metabolic acidosis, only increased osmolar gap. Causes CNS depression and ketosis, but no metabolic acidosis. D. Salicylate toxicity, incorrect. Causes mixed respiratory alkalosis ampulosis, metabolic acidosis. No osmolar gap or visual symptoms. Key takeaways for the medical revalidation of Puerto Rico exam. Methanol poisoning presents with metabolic acidosis, osmolar gap, vision loss. Key symptoms: blurred vision, snowfield vision, optic disc hyperemia, confusion. Diagnosis: anion gap metabolic acidosis, elevated osmolar gap. Treatment: fomepizole or ethanol inhibits alcohol dehydrogenase. Sodium bicarbonate for acidosis. Hemodialysis if severe toxicity. This is a critical toxicology question for the medical revalidation of Puerto Rico exam.